case cart that's been pulled for you with all of the supplies that you'll need. So you will then have a preference card that will look like this and will tell you the type of procedure that you're doing. And then you're going to utilize this preference card to go through this case cart and determine what's going to be open and used immediately from the beginning of the case, and then what's going to be held and maybe used later on, just depending on how the case progresses. So we want to set things around where they're going to be opened, and then anything that's not a large item will just go on the bed. At that point, we just assume that the patient's not in the room yet. And then we will open those things to the back table and the basins once we get those open. So the basin in the ring stand, the instrument set on another ring stand or a prep stand if you had something like that to open on. The pack goes on the back table. And then you're just going to start to go through all of these other supplies that are contained within the case cart. Just looking down the list of supplies and verifying if it's in the open column, then it needs to be on the bed, or if it's in the hold column, it gets organized on the top of the case cart. Remember that your size gown and gloves will be listed on the preference card, so that is the gloves that you are going to don and the gown that you are going to don after performing your surgical scrub. So we're going to be opening one package of Raytex, one package of laps, a suture, a package of towels, and then your gloves. Now, if you wear two different sizes of gloves, you're going to put your larger glove on the Mayo stand and your smaller glove on the back table so that you're donning your larger glove first. And then anything else that we determine is hold, we just kind of organize neatly on the top of the case cart. That way, if the circulating nurse needed to open something to us during the case, it could be easily located. Now it looks like this is already open, so of course we would want to make sure that we get another one of those because we wouldn't trust that. We don't know if the integrity of that inside package had been compromised in any way. All right, once you go through those items, you then are going to push your case cart just off to the side so it's out of the way. So it's not going to impede you from over-exaggerating your sterile boundaries as you start to open. Okay? At that point, then we're going to start to open our room. Remember, you're going to have 45 minutes from when you open the back table until you hand the knife. So once you get yourself situated, then your time will start. Okay, so we always start with our back table first because it's the center of my field. If I opened anything else first and then went to open my back table, I would be turning my back to an item such as my basin if I opened it first. When I open my back table, I want to make sure I pull out in line with the surface, making sure I don't lift up high, and I don't want to create air currents, and I don't want to shift the cover as well. As I walk around, I want to make sure I face the field, being at least 12 inches, but 18 to 24 is better. Facing the field, making sure my hands are in, walking around to the other side. Remember that these surfaces you can always move away to give yourself extra room as you open those items. Okay? Again, opening that, facing the table as I walk around. I'm then going to go to my basin and open that. So I want to make sure that I open the flap away from me first, the two side flaps, and then the flap closest to me. Now, this table and this basin are not the same level, so I cannot bring them up beside each other, so I want to make sure there's at least 12 inches of space between them. But I don't want them to be very far away because then somebody potentially could walk between two sterile fields. I'm going to open my Genesis pan. So I'm looking to verify the indicators or the tamper evident arrows on the outside to make sure that they've changed and that they are intact to make sure that somebody hasn't popped the pan. And I'm looking for the filter on the top as well. Make sure you cover those arrows as you open so that they don't go flying and contaminate your field. You then are going to take the lid off, making sure that you tilt it back and don't drag it over the top. You then are verifying the filter around the outside, making sure it's locked in place, and then taking it out and checking for any holes. In the clinical site, we will take this and put it in the trash, but for our purposes, a lot of times we will save it so that we can reuse it as we practice in the lab. You then will take and put this lid underneath the bottom, but make sure that you watch your face so it doesn't get too close to your sterile instruments. Again, remember, this is all unsterile, so I don't want to bring it too close to my basin up here. Okay. Then I'm going to open my gown on my mayo stand. So you're going to open the dust cover, verify for any holes in the dust cover, and then you can throw that away. Then when you open the mayo, or the gown on the mayo, you open the flap away from you first, then the two side flaps, and then the flap towards you. Sometimes you need to pull against yourself because there's a lot of memory. So make sure that you don't walk between two sterile fields here, and make sure that you also don't reach over the top of your gown. So you kind of rotate yourself around and then pull against. All right. Then I'm going to open my other items that I've determined are going to be open over here. Okay, so I have a package of Raytex that's packaged with this paper over the top and then the plastic. There'll be an arrow, which is the corner that you grab. Okay, we're going to pull that back and then approach the field and toss it on, making sure that you don't come too far over so that you're reaching over the table. And then we're going to check our wrapper for any holes. We're going to open a suture. So we pop the top, and then you're going to shoot that on, checking again to make sure that there's no holes in the wrapper. We have our lap sponges, which do come in a dust cover. So you're going to open those up, pull them out. Again, check the dust cover. And then these are going to be envelope wraps, similar to how towels are often wrapped. So you want to open the flap that's away from you first, the two side flaps, and then the flap closest to you. You want to make sure that you have all the flaps contained. You want to approach the field and then toss it on. And then check your wrapper. And then I have a package of towels, which is going to be very similar. So again, the flap away from you, the two side flaps, and then the flap closest to you. Approach the field and toss it on. Had I hit the field and then they fell off, I still would want to make sure that I check my wrapper, because potentially we could have had contamination as well. All right, gloves. Again, if you have two different sizes of gloves, you usually want to put the larger size of gloves on the mayo stand and the smaller size of gloves on the back table, because you'll want the larger size to be underneath. So you open your gloves, approach the field, toss them on, check your wrapper, and then we're going to go to the mayo stand. Again, making sure they don't shift over that laminated edge, approach the field, and toss them on. Now, remember that on the wrapper, they need to be within the 1 inch margin, but if it's so close that it makes you question if it's contaminated, it's too close. So for my comfort, I think they're too close. So I'm going to grab some new gloves and open them. Okay, so again, opening them up, making sure they commit to the side that's furthest away, and then flipping them on. Checking the wrapper to make sure the integrity is good. Okay, once everything's open, then you're going to go do your surgical hand scrub. Okay, so we'll go over to the scrub sink.